name is Erin Pierce, and I'm here to talk to you about improving preoperative evaluation and preparation of elective surgical patients. Preoperative assessment and evaluation is used to properly prepare a patient for surgery and plays a critical role in maintaining patient safety. The main focus of improving preoperative evaluation and preparation is improved patient outcomes. Making sure patients are properly prepared for surgery prevents last-minute cancellations by making sure that they are at an optimal state of health. Preventing these cancellations improves patient outcomes and patient satisfaction, both of which play huge roles in today's healthcare. Day of surgery cancellations also decrease operating room efficiency and waste resources, which increase healthcare costs. Preoperative assessment also helps to reduce anxiety of patients by providing education, which also increases patient satisfaction and patient outcomes. The Agency for Healthcare Research and Quality and the National Guideline Clearinghouse developed a guideline called the Perioperative Protocol Healthcare Protocol, which provides evidence-based best practice recommendations for preparing patients for surgery. The guideline states that all patients scheduled for elective surgery must undergo a basic health assessment. This basic health assessment must include a complete medical history and physical examination. Any abnormal findings discovered during the basic health assessment would require further assessment to optimize the patient for surgery. All patients that are scheduled for elective surgery should be seen preoperatively and thoroughly evaluated. All of these patients need to have the same basic preoperative preparation, but depending on known health conditions, further in-depth evaluation and preparation may be required to ensure that they are in an optimal state of health. For a healthy patient, this basic preparation may be nothing more than being seen by the nurse and an anesthesiologist in the pre-admission testing department at the hospital before surgery. But a patient with known health conditions should be thoroughly evaluated by their primary care physician or other specialist. By following the recommendations in the perioperative protocol guideline, we can ensure that our patients are optimally fit for surgery, have the best patient experience, high patient satisfaction, great patient outcomes, and the best use of hospital resources. Under the Affordable Care Act, the reimbursement for hospitals is based on quality care and positive patient outcomes. If patients have good outcomes, then hospitals will receive reimbursement for care given, and if outcomes are not good, they will not. A hospital's quality information is readily available to the public on the internet. In addition, physician quality information is also available to patients so that they can shop around for a physician. If patient outcomes are not good, then a physician's quality ratings will not be very good. If this information is not good, then a patient may be discouraged from choosing a certain physician or a hospital. Therefore, it is important to have the best outcomes possible, and thorough preoperative evaluation can lead to the best outcomes. In the outpatient surgery department where I work, we admit and process all of the patients that come in for surgery. We have between 60 and 70% of our patients seen in our pre-admission testing department, or PAT, prior to surgery. While we do have a good many patients attend PAT, this number should be 100%. Inadequate preoperative assessment and evaluation can lead to last-minute attempts on the day of surgery by the preoperative nurses trying to obtain information on a patient in an attempt to avoid cancellation. If these patients were seen in a timely manner in the PAT department, this could be avoided. No one ever wants to cancel a patient. I don't know how many times I've said to a patient, we would rather be safe than sorry. The patients are never happy about it, but they do understand we have their best interest in mind. Implementing the recommendations set forth in the guideline and making sure that all patients attend PAT preoperatively would decrease last-minute cancellations, thereby improving patient outcomes and satisfaction. The problem with patients being inadequately prepared for surgery is one we see every day. We may not cancel patients every day, but I would say we do have to call and search for tests or reports on at least one patient every day. We want to provide the best care for our patients, and ensuring we have all of the information available to make sure that our patients are in the best state of health they can possibly be is crucial to providing safe patient care. The main people that would benefit from this thorough evaluation and preparation would be the patients. After all, they are the reason we do what we do every day. Many of our patients come from out of town, and we are told this is why they do not attend PAT. I can see how this could be a little burdensome, but it would be better than coming in and being canceled at the last minute on the day of surgery. The hospital staff and surgeons would also benefit from having patients properly evaluated. The hospital and staffing resources would not be wasted due to cancellations, and instead of having a patient scheduled for surgery that was not adequately prepared and therefore canceled, the surgeon could have scheduled a patient that was more well prepared and ready for surgery. I have reviewed several case studies that evaluated the use of pre-admission testing departments and last-minute cancellations in the hospital settings around the world. All of these studies revealed a decrease in cancellations and an increase in surgeries performed among the patients that were evaluated preoperatively in the pre-admission testing department as opposed to those that were not. This shows that having patients properly evaluated will decrease cancellations and increase operating room productivity. Making sure that patients are properly prepared for surgery is crucial. Preoperative assessment and evaluation plays the biggest role. A quote from an article from the online journal Implementation Science says it all. Health work teaches us with great rigor that action without knowledge is wasted effort, just as knowledge without action is a wasted resource. We have much knowledge through research that thorough evaluation and preparation is critical in making sure that patients are in an optimal state of health for surgery. We must take this knowledge and act on it. We know that with relatively simple changes to current processes, we can have a big impact on patient care. By making sure that patients are properly prepared for surgery, we can decrease last-minute cancellations, increase patient satisfaction, and have excellent patient outcomes.